quite a task to pry you loose, to bring you over here, and we are delighted that you're here, and we're now starting to see some of the fruits of your labor. So with that, we'll welcome you to introduce Joseph.
Good morning, President Dean, Dean Kelton, Joseph, ladies and gentlemen. So it's obviously a great honor and pleasure to be here today and participate in this wonderful event. It does truly mark a new era in the history of the Department of Clinical Epidemology and Biostatistics, C&B for short, that began with David Sackett over 40 years ago, in fact. Has really changed healthcare and how healthcare is delivered around the world. Evidence-based medicine, for which C&B and the university at large is perhaps best known, at least with a very subjective view, is a direct result of the visionary leadership of the university and the department at the time. The impact has been enormous throughout the world of healthcare for sure, but it is going beyond the world of healthcare with disciplines of evidence-based policymaking, evidence-based, and so on, growing increasingly. C&B has actually counted and counts amongst the faculty some of the most outstanding biostatisticians, Mike Gent, Stephen Walter, and Dr. Joseph Beyene will actually just follow in the footsteps of these outstanding biostatisticians. We actually need to continue on the path of changing and leading the world and making impact in healthcare. And I think the John D.Cameron Chair in Genetic Determinants of Chronic Diseases actually presents such an opportunity. As was already said, individualizing healthcare and generalizing from large research studies remains a very big challenge. I believe that we have a real opportunity here to make a very, very big contribution, not because we are the first to do that, but we are special in terms of how we do this. This university it's different from other academic institutions. It lives from its collaborations, and the population genomics program directed by Sonia Nand is one of the opportunities for these outstanding collaborations. In addition to that, chronic diseases such as cardiovascular disease and cancer were actually mentioned here. I think there are other opportunities. Chronic obstructive pulmonary disease is the fourth leading cause of death, the only one that is predicted to increase further. So there are other diseases that need to be explored, and my vision is that at the end we will be able to explain genetic causes to the population at large and invite them to better participate in decision-making about their health by finding causes of disease and finding treatments. So the work of the population genomics program is also supported by our graduate program, the HRM program, that involves over 200 master's and PhD students that will be